afternoon, Prime Minister, the Honorable William Marlin, Minister of Finance, the Honorable Richard Gibson Sr., Minister of Public Health, Social Development and Labor, the Honorable Emil Lee, and of course we have our panel representing to the left of the Minister of Health. We have representing the SZV, Social and Health Insurances, the Chief Customer Officer, Parveen Burche. And we also have to the right of Minister Lee, representing Health City Cayman Islands, Marketing Representative Mr. Shamari Scott. Ladies and gentlemen, good afternoon. I'm Cedric Peterson on behalf of SZV, Social Health Insurances, Health City Cayman Islands, and of course the government of St. Maarten. We welcome you to today's press conference covering the agreement that's going to be discussed and highlighted in our press conference between SZV, Health City Cayman Islands, and the government of St. Maarten. To set the tone for our press conference this afternoon, I would like to invite to the podium to address you with some opening remarks, the Prime Minister, the Honorable William Marlin.
Thank you, and good afternoon. A hearty welcome to our Minister of Finance. Welcome back home, our Minister of Public Health, Minister Lee. And it is for me a great honor and privilege on behalf of the government of St. Maarten, the entire Council of Ministers, to say a hearty welcome to Mr. Scott, the Marketing Director of Health City. It is not my responsibility to further disclose the content of the agreement or to expound upon it. We've had extensive discussions in the Council of Ministers, and of course, we embrace the initiative and the opportunity that this new agreement will offer, and we hope it will have, of course, tremendous benefits to healthcare for the people of St. Maarten. I want to congratulate in advance SZV, the Minister, and all who have played and will continue to play their role. But more importantly, as I said, I just wanted on behalf of the government and people of St. Maarten say a hearty welcome to Mr. Scott, and hope while this may be your first visit, and if it's not, that we hope it will translate into more visits personally, more visits on the part of people from the Cayman Islands, that this does not become a one-way traffic of our people going to the Cayman Islands, but at the Cayman Islands people, through the relationship that you will develop here with our medical insurance company, that you will see the benefits in using St. Maarten, like the many millions who do so, at least 2 million cruise passengers annually, and over some 600,000 stayover people. And we have not been able to see any significant amount from the Cayman Islands coming this way, for whatever reason it may be. So since we will be exporting ours for health reasons, you can send yours our way for tourism and recreation reasons. So having said that, I want to welcome you and wish you much success in this venture with the government or with the SZV on behalf of the people of St. Maarten. Welcome.
Thank you very much, Prime Minister, for your opening remarks. At this time, I invite the Chief Customer Officer of SZV Social Health Insurance, Miss Parveen Burche, to make her opening remarks this afternoon.
Thank you, Mr. Peterson. Good afternoon. My name is Parveen Burche. I am the Chief Customer Officer of SZV. SZV is very delighted to be here present today to be part of this very important first flight for our patients to the Cayman Islands. SZV looking forward to partnering up with the Cayman Islands, especially to deal with a backlog of patients that we are currently experiencing. We are currently experiencing a backlog when it comes to 3 types of treatment, which is urology, neurology, and neurosurgery. We are going to start with this pilot phase for the upcoming 6 to 8 weeks for a special target group, and we will definitely monitor and evaluate the results very closely and give our advice to the Minister of Health in order to together make the decision how to continue forward. Needless to say, SZV is fully supporting a general hospital for the country of St. Maarten. But until we reach that point, we are taking every opportunity that we have to expand our network of medical referrals abroad. And I am happy today that we are partnering up with the Health City Cayman Islands institution. Thank you.
Thank you very much, Mrs. Buttigieg, for your opening remarks. I now turn the mic over to Mr. Shamari Scott, the Marketing Director, Health City Cayman Islands. You have the floor.
Thank you, and thank you for the warm welcome. And Prime Minister, just want to state, in a previous life, I was the Director of Tourism for the Cayman Islands. So back in, I think it was 2003, you had the big opening of your port facility, and I was here, and of that 600,000, I must have been 1,000 visits since then. So St. Martin's like my second home, so this definitely isn't the first and definitely won't be the last, but to your point, now that we have direct service, I can get more of my friends to come and experience the St. Martin that I've been telling them about. So protocol already being established, I want to thank you all for being here today while we announce our strategic partnership with SZV Social and Health Insurances of St. Martin, and consequently, of course, the chartered service that we have with our national carrier, Cayman Airways. With the agreement with SZV, Health City Cayman Islands continues to grow our patient numbers and reach new markets to build our medical tourism, or as we term it, destination healthcare within the Cayman Islands. We have ongoing operations in a number of Caribbean and Latin American markets, in addition to agreements with self-insured companies in the United States and our own dedicated office in Hamilton, Canada. And our international patients continue to grow year over year significantly. Health City Cayman Islands treated international patients from more than 60 countries in 2016. As our third anniversary actually approaches, we have treated over 25,000 outpatients and close to 3,000 inpatients to date. Health City Cayman Islands has achieved these numbers while maintaining the highest quality of care standards, bringing medical innovation to the region and continually expanding into new markets. As part of this partnership with SZV, Health City Cayman Islands will provide tertiary health care to St. Martin residents, as was mentioned in regards to help with areas of a backlog currently. However, we look forward to also helping in the other myriad of specialties that we have within Health City. While Health City Cayman Islands benefits by this agreement, we also know that we will be providing St. Martin residents with the highest of quality and, even more important to us, compassionate health care. We offer the services of highly skilled medical professionals and the latest technology advances in both diagnostic and surgical procedures and techniques with proven success rates. Health City Cayman Islands accreditation by the Joint Commission International is a testament to the quality of care provided to our patients at our facility. Our unique pricing model also offers cost savings to those paying the bills. We're also very excited to be able to outline the fact that we are vertically integrated and we have created a bundle that is all-inclusive. There's a fixed price for the air, for the accommodation, for the food, the meals, and of course for our medical services. This gives SZV certainty and helps to manage financial risk by knowing what your costs will be beforehand. Our first flight from St. Martin to Cayman will leave tomorrow and with patients and SZV officials on Wednesday 29th at 9 a.m. St. Martin time and arrive in Grand Cayman at around 1:30 p.m. local Cayman time. It's anticipated that the direct charter flights will continue for an initial period of 8 weeks with approximately 20 people on board each flight. Once the schedule is completed, Health City Cayman Islands and SZV, as you heard previously, look forward to the continuation of this service. Overall, the agreement with SZV adds to an increasing number of agreements Health City Cayman Islands has with regional governments, insurance providers, to become a service provider of choice for specialized tertiary care. Such agreements underscore Health City Cayman Islands' ongoing commitment to increasing access to our world-class renowned medical services in order to ensure that our brothers and sisters in the Caribbean can take part. I thank you all for having me here today.
Thank you very much, Mr. Scott, for your opening remarks. I now invite the Minister of Public Health, Social Development and Labor, the Honorable Emil Lee, to address you.
Thank you very much. Greetings to the Prime Minister and Minister of Finance. Nice of you to be here to welcome me home. A special thank you to my host during my time in Cayman, Shamari from Health City, and the government of Cayman Islands. As per typical behavior for myself, I asked for no protocols to be given when I arrived to Cayman because I want to be able to experience what our passengers experience coming into the island. And so Health City arranged the normal pickups, for example. But in the past, one of the issues with accessing the services provided by Health City is visas and access. So the easiest access has been via Miami, but many of our patients here don't have U.S. visas, and that's been a problem. And so as we've looked to our discussions with Health City about how we access the facilities, that's where the direct flight became critical. So when I went to Cayman, I went via Miami, and I saw what the layovers were like and what the visa issues would be for SZV descendants patients. But I must say that the quality of service that was provided during the stay was tremendous. And it's very nice that all of a sudden our patients are going back to a Caribbean island where they feel more comfortable, where you have roadside barbecues. Okay, they drive on the wrong side of the road, but otherwise everything there feels very much like home. I had an opportunity also to try some of the services like executive health screening so I could see what the intake process was like and what the consultation process with specialists was like, and I found that the entire process was very professional. Also had an opportunity to participate in press conference with the Premier and Deputy Premier and with Health City and with radio interviews. So the people of the Cayman Islands are very much supportive and very much interested in this business relationship because as they look to grow their tourism numbers, this is medical tourism in practice. And during my time as CHTA President and working with your Deputy Premier, Mr. Honorable Kirkconnell, who is the Minister of Tourism, we've always talked about how we develop travel within the Caribbean and how we support each other. And so it's nice to be able to bring that into reality. On the short term, SZV has the responsibility for handling the backlog, for making sure that our transition, bringing our patients to Cayman is seamless. My purpose for being there was not to get into the affairs of SZV, but really to look at things from a much longer term perspective. As you all know, we are working towards building a new hospital for St. Maarten. One of the goals that we've outlined is we'd like to have that hospital become JCI accredited, which is an international standard. So we recognize very much that a new hospital is simply a building and that we need to make sure that the staff are up to standards, that the equipment is up to standards, and procedures and protocols are up to standards. And that's one of the interesting things about working together with Health City is that they are already JCI accredited. As a matter of fact, their facility, I was very impressed, was built in a year and very quickly JCI accredited. So besides looking to send our patients to Cayman, we're also looking for technical support, for that advice from Cayman in terms of how we can improve our services here, and in them I believe that we have found a willing partner, an able partner. So we look forward to working together on the long term. And what the flight really does is it gives us the possibility to bring patients, but it also gives us the possibility to deepen and to develop these relationships and see if these opportunities can translate into long-term benefits both for Cayman and for St. Maarten. Also of interest, tourism is all about seeing other cultures and experiencing their lifestyle. And one of the things I noticed that in Cayman they had issues with their landfill many years ago. They seem to have found a good interim solution and are working towards a longer-term solution. So I had the opportunity to speak to the government of Cayman briefly about how can we exchange best practices and also what lessons have been learned, positive and negative, and how we can translate those back to St. Maarten. So I found the trip to be very productive. I found the hospitality to be warm and accommodating. Thank you very much.
Thank you very much, Minister Lee. I'd like to thank, of course, our panel for their remarks this afternoon. I invite everyone to turn their attention to our monitor here to the right-hand side for a video presentation by Health City, Cayman Islands.
My cardiologist in St. Maarten, Dr. Meredith Sydney, recommended me or referred me to Dr. Ravi here in Grand Cayman, and I don't regret it one half a second.
The fact that I could talk to Dr. Ravi, I'm very impressed about how he's working and how it is able to discuss cases with him, and especially when they're, well, not clear-cut cases. So brainstorming with Dr. Ravi is absolutely fabulous.
I should recommend this institution to everyone, wherever in the world, who might need some medical attention, especially in this field.
And when they took me to the hospital, they found out I had a problem with my heart. I went and see my family doctor in St. Maarten. He called a cardiologist at St. Maarten Medical Center immediately, and he sent me over there. I saw Dr. Sydney, where she became my cardiologist, and she recommended Health City.
In recent discussions with my cardiologist in St. Maarten, she recommended, because of the fact that she visited Health City Cayman Island, she recommended Health City Cayman Island for the follow-up checkup that I needed to do.
My problem that I had to go to Colombia, and for some reason the doctors in St. Maarten decided they had contact with Health City, and they think Health City was the best place for me to go. I've been having problem with the heart. My heart was, they claimed to say they had a leakage, which is one of the valves was leaking.
I would recommend Health City because not only the service is good, the treatment also is good, and the staff, they're very nice.
The service was tremendous, I must say, and the care from the medical staff to the specialists was, I'd have to look for a special word to talk about how the care was, but the care was fantastic.
I've been treated very, very well at Health City, since second to none. I was, what I had was an open heart surgery, the valve, they repaired the valve. But before, I must say, before anything was done, I met so many different doctors, and every doctor had his portion to do. And they explained to me, word to word, letter for letter, what they were going to do. And I found that so tremendously great, that it gave me courage just to let it happen.
Well, I would say thank you to Dr. Rafi, thank you to Madhu. She makes me feel comfortable from the time I walk in on Monday. And thanks to all the staff.
I think myself and Dr. Rafi has become personal friends. That's the way I feel. He is very personal, very attentive, because I felt very comfortable. From the moment I met him, I felt very at ease with him.
There is the Health City, and there is Dr.
Well done.
Ravi.
Thank you
right
very
there,
much,
so
representatives of
we
Health
shouldn't be
City,
scared of
for the
anything.
video
Everything is
presentation.
possible.
I need some cards. Make Dr. Ravi my best friend. Well, that brings us to the end of our presentation. I want to thank everyone who has cooperated this afternoon, and I would like to open the floor for any questions the media might have, if there are any. Okay, great. Then that brings us to the end of our official press conference. Prime Minister, Minister of Finance, Minister of Health, and the members of our panel, thank you so much for bringing this presentation to us.